Pharm-D 5th year Toxicological approach. Animal toxicity, acute toxicity. Acute toxicity studies should be carried out in at least two species, usually mice and rats, using the same route as intended for human. In addition, at least two more routes should be used to ensure systemic absorption of the drug. This route may depend on nature of the drug. Mortality should be look up to 72 hours after parenteral administration and up to 7 days after oral administration. Symptoms, signs, and mode of death should be reported with appropriate microscopic and microscopic finding where necessary. Lethal dose 50 should be reported, preferably with 95% confidence limit. If lethal dose 50s cannot be determined, reason for this should be stated. Long-term toxicity. Long-term toxicity should be carried out in at least two mammalian species, of which one should be non-rodent. The duration of study will depend on whether the application of the market permission or for clinical trial, and in the later case on phase of trial. If the species is known to metabolize the drug in the same way as human, it should be preferred in long-term toxicity study. The drug should be administered 7 days a week by the route intended for clinical use in human. The number of animals required for this study, that is the mammalian minimum number in which the data should be available. A control group of animal given in vehicle alone should always be included, and 3 other groups should be given graded doses of the drug. The highest dose should produce observable toxicity. The lowest dose should not cause observable toxicity but should be comparable to the intended therapeutic dose in human or multiple of it. Example 2.5x. 2. Make allowance for the sensitivity of the species. The intended dose should cause some symptoms but not gross toxicity or death, and may be placed logarithmically between them other two doses. Reproduction study. Reproduction study need to be carried out only if the new drug is proposed to be studied or using in human of childbearing age. 2 species should generally be used, one of them being non-rodent if possible. Fertility study. The drug should be administered to both male and female, beginning a sufficient number of days before mating. In female, the medication should be continued after mating, and the pregnancy one should be treated throughout the pregnancy. The highest dose used should not affect general health or growth of the animal. The route of administration should be the same as therapeutic use in human. The control and treated group should be of similar size and large enough to give at least 20% animal in the control group of rodent and at least 8% animal in the control group of rodent, non-rodent. Observational should include total administration of the latter from both the group, including spontaneous abortion if any. Teratogenicity study. The drug should be administered throughout the period of organogenesis using 3 doses label. One of the dose should cause minimum maternal toxicity and one should be the proposed dose for clinical use in human or multiple of it. The route of administration should be the same as for human therapeutic use. The control and the treated group should consist of 20% female in case of non-rodent. On each dose, Observation should not include in the number of implementation sites, resortation if any, and the number of fetus with their sexes, weight, and malformation if any. Parental study. The drug should be administered throughout the last third of pregnancy and then through lactation and weaning. The control of each treated group should have at least 12% female, and the dose which cause low fetal loss should be continued throughout the lactation, weaning. Animals should be sacrificed and observational should continue, including microscopical autopsy and where necessary histopathology. Next topic is local toxicity. This study are required when the new drug is proposed to be used, typically in human. The drug should be applied in an appropriate site to determine local effect in a suitable species such as guinea pig or rabbit. If the drug is absorbed from the site of application, appropriate systemic toxicity should be required. Mutagenicity and carcinogenicity. This study are required to be carried out if the drug or its metabolite is related to a non-carcinogenic carcinogen, or when the nature and the action of the drug is such to suggest a carcinogenic mutagenic potential. For carcinogenicity study, at least 2 species should be used. These species should not have high incidence of spontaneous tumor and should preferably be known to metabolize the drug in the same manner as human. At least 3 dose level should be used. The highest dose should be sublethal but cause observable toxicity. The lowest dose should be comparable to the intended human. Therapeutic dose or multiple of it, example 2.5x, to make allowance for the sensitivity of the species. The intermediate dose to be placed logarithmically between the other 2 doses. The control group should always be included. The drug should be administered 7 days a week or a fraction of the lifespan. The lifespan comparable to the fraction of human lifespan over which the drug is likely to be used therapeutically. Observational study include microscopic changes observed at autopsy and detailed histopathology.